So, okay, so nursing home care and home health care. These are the types of costs that are paid for by Medicare, okay? So, home health aides. Let's say you come out, you're going to go into a facility. You've come out of the facility, you need some care at home. Great, Medicare will pay for that, but it has a limitation on the amount. It's only 100 visits. So if somebody's coming out twice a day, you know, you're basically covered for 50 days, like a month and a half. And then, you know, it's done. And there's all kind of restrictions on that. You have to have gone into the hospital first, and then be discharged, and then the doctor has to prescribe this home health care that you need. And it's similar for nursing home care. You go into the hospital, you immediately go into the nursing home for rehabilitation, and you get rehab. You get physical therapy, you get occupational therapy, and if you get that, Medicare will cover, but only up to 100 days. And you know, out of those 100 days, you have a copay after the first 20 days. So for 20 days, they pay for everything. After 20 days, you got to pay $152 a day copay. So you're paying over $4,000 a month, even when Medicare pays. And then after 100 days, the benefit is maxed out, and you have no more coverage. So, because they, you know, the thought was that most people, if they're going to get better, they're going to get rehab. They'll give you get 3 months of rehab or a little bit more, and if you haven't come back, you're just not going to come back, and then they terminate that. And if you need to stay in the nursing home after that, you basically have to pay for it yourself. And like I said, it's at like $10,000 a month. So a lot of people who never knew about Medicaid start looking to get Medicaid because it's the only government source of payment of these long-term care costs. So you can't come out of the nursing home, or you have to go in an assisted living facility, or you can come out and go home, but you need home health aides, and you need them like round the clock. Medicare doesn't pay for that. So I just put down a couple slides about Medicaid because it really comes into play a lot with elderly and disabled people. If it has an income limit, if you need home health aides or assisted living facility. If you have over $2,163 a month, $2,163 of all income, like if you get Social Security and a pension and it comes out to above $2,163, you're ineligible for Medicaid in the community. That is ineligible for home health aides or assisted living facility. Not for nurse. You can still get nursing home care, but there is an income cap for these other programs. And like I said, the resource limit is very low. You can only have $2,000 a month, $2,000 in your bank account in order to be eligible. If you have over $2,000, you're ineligible due to excess resources. So the idea is that you need care. You can't perform the activities of daily living. You've used all your money to pay for care, and you spent everything down, and you still need care. So that's when you apply for Medicaid. And there's also all these rules, you probably heard of them. If you're going to transfer assets, like most people are going to say, oh, gee, I got to spend under $2,000. I have children, I have loved ones. I'm going to gift my assets to them, and then I'll apply for Medicaid. So that maybe they'll have $100,000, or maybe they'll have a house. So they'll sign a deed and transfer it to the kids, or they'll just write a check to get all the money out of their name. They'll only leave $2,000 in their bank account and apply for Medicaid. Well, there's this rule that says if you transfer assets within 5 years of the date that you apply for Medicaid, we're going to give you a penalty based on the value of what you transferred. So try to make sure that people don't gift all their assets away. So Medicare covers home health aides, and it covers nursing home costs, but it has to be for therapy or skilled nursing care. And there's no, you know, Medicare you paid for, paid into the system when you were working, so there's no financial limits. You're gonna have $1 million and be eligible for Medicare. Whereas Medicaid, it covers the same things: long-term care, nursing home care, assisted living care, home health aides, but you have to have, you know, there's strict financial limits in order to be eligible. That's basically the difference between the two. And then I just wanted to point out this VA programs. You know, a lot of people who were injured in the war have VA compensation benefits, but there's also a VA pension benefit that's available, and that you don't have to have a wartime injury to be eligible for VA pension benefits. A lot of people that come into the office that served a year, 2 years, 3 years, and then, you know, haven't had anything to do with the service since then, are eligible for a VA pension benefit. And for the veteran, you can get about $2,200 a month. For the spouse, a widow or widower of a veteran, you can usually get about $1,100 a month. That's the maximum. So it really helps out to pay for care costs. It's really, I'm sorry.
My husband, has died, and to tell you the truth, I wasn't aware that you can still apply for veterans care?
Yeah, you can
As long
still.
as he was in service.
Well, here's the rules. This is the slide that tells you about the rules. The rules, you had to serve, the veteran had to serve at least 90 days,
He was in 2 years.
1 day of which had to be during a period of wartime. Didn't have to serve during active duty,
Vietnam.
and fine, then he qualifies. But it's a funny type benefit, just let me go on. So here's the eligibility. You can get a low-income pension, you can get a housebound benefit, or you can get aid and attendance benefits. But it's specifically to pay for care costs. So what you really need, again, it's a medical criteria and it's a financial criteria. That means if you have a lot of money in the bank, they're going to look at it and want to know about it. And they look at to see if you have sufficient means. And if you have income like Social Security or pension or things like that, that also counts. When it really comes in handy is if you have home health aides that are coming in, and the cost of the home health aides, let's say it's $5,000 a month, maybe your income is $2,000 or $3,000 a month, and you need additional income to pay for those home health aides. That's when it comes in handy, and that's when most people are eligible, because the cost of care offsets the income that you receive. When that happens, then you can be eligible for this VA benefit. Okay? They always look at this net worth. They see, hey, based on your age, do you have enough money to pay for all your care needs? That's basically what they're asking for. And the thing about the VA benefit is that, as opposed to Medicaid, there's no look-back period. So you could transfer assets out and be eligible the next month. And there wouldn't be any look-back period to stop you. Okay, that's all I have.
That was good.
Yep.
That's good.
Good. Do you have any questions, anybody? Okay, thanks for your attention.
Yes.